diabetes and sexual dysfunction. Diabetes and sexual dysfunction is very common, more than what people think, but people don't talk about it. Erectile dysfunction and low libido is a very common thing to have, even though you take medications and you follow doctor instructions. Hi, this is Georgina Zagaru Chavez again, and we're going to be talking about diabetes and sexual dysfunction. One of the problems they have seen a lot in clinic and is very common with people with hormonal imbalance. Diabetes is correlated with insulin, and insulin is a hormone. Sexual dysfunction. Why sexual dysfunction? Because the sexuality in our body is not a priority. It's not a priority of a brain. Since that you have poor circulation in your body, sometimes you don't get the blood circulation into the sexual organ. And it's very common to have that mainly in males, because females sometimes they don't say anything because they think that they just have to be able to do that. I have experience with my patients that they told me that they have low libido, that they don't want it, that they don't crave it, so that their sexual desire is low. In males, unfortunately, the erectile dysfunction is very, very, very common when people have diabetes. Sometimes when I talk in groups and settings of people that they are like just talking with friends and family and stuff, and people that have diabetes, and I talk that topic, most people they act like, I don't want to talk about it, because a lot of males they get embarrassed. But it is very typical, it is very normal. And the only thing that you have to do is improve it. And you can improve diabetes type 2 in a very, very easy way to do it. But you have to be compliant. Now, one of the things I see in people with diabetes, it is a problem they don't want to follow. They don't want to follow instructions. They want to keep going with the bad habits. Sometimes I have to use some mental or stimulating mentally in order for my patients to be compliant, because a lot of people they want to stay in the hole, in the bad habit. And if you stay in the bad habits, you're never going to improve diabetes or the side effects of diabetes. And if you ever wanted to be sexually functioning like a normal human being, you have to go ahead and improve diabetes. So one of the things that I was talking when they wanted to use mental, we can use tapping, like tapping to get like new things, new changes into your life. We can use hypnosis. I'm a hypnotherapist. Hypnosis is very good to change bad behavior. Sometimes we use little tricks and then it works. The mind is a muscle that you can trick. So you can do so many things in order for you to trigger and change the behavior. And the main reason that we don't change our behavior is not because we don't know this hurt or not. It's not because we don't want to change it. It's because we feel safe. And feeling safe, you keep repeating the same pattern. And in hypnosis, they say something. You are what you know what you don't know. And when you don't know, you get frightened. So sometimes changing the behaviors need more than just, oh, I want to do it, and willpower. Because sometimes even with willpower, you cannot do it. But like I said before, sometimes you can do little tricks and it will. Another issue that I see a lot of people is the emotional part. Like a lot of people eat certain food because of the emotional side of the coin. So if they are doing certain behavior because of emotion, you have to remove those items in order for you to keep going and to have a better life. Now, when I'm talking about mental issues with diabetes, you don't have everything together. You will never improve anything. I always tell people, here with me, you are not just the digestive, because actually diabetes type 2 is include diabetes type 2 includes digestive system and the immune system, but also too the mental aspect is very important. So if you're ever gonna take a treatment or you're gonna do something in the side of your medical instructions, your doctor instruction, you have to go ahead and include some sort of meditation, some sort of hypnosis, some sort of tricks for your brain in order for you to change your behavior. I know that sounds a little odd to you, but it will work very good for you. And a lot of programs for, like for money making things, they say you got to have your brain in the right place. And it is important to have your mind in the right place in order for you to function and do the right thing. Because no matter what you do, you don't have your mind in the right place, the rest of the stuff. Next time that you take treatment or you use something else besides lifestyle and diet, remove toxicities, reduce stress, or maybe remove parasites, just include the mind and use a trick. The mind is easy to trick. All right, so until next time, thank you very much and see you in the next one. And the next time we're going to be talking about diabetes and kidney failure. It is very common, more than anything else, and I'm going to give you another trick and tip that you can utilize for your diabetes. Until next time, thank you very much. Subscribe and see you.